A very good evening, everyone, and welcome to today's workshop. Thank you for joining us. So, some of you may be parents, caregivers, some of you may be professionals, and we all share a common goal where we want to help children reach their fullest potential. So, today's session will be about understanding how we can better support a child's journey. So usually when we see a child struggling with speech or learning delay, behavior issues, etc., the whole focus is mostly on what we are observing in the child. But it's important to understand that these behaviors are actually, the brain's way of telling us that something deeper is happening. And with all developments in science, research, etc., it's very clear now that brain is not a fixed organ and it's constantly changing, adapting, and rewiring itself. And this process is called neuroplasticity. And one of the most important aspect is synaptic pruning, through which the brain strengthens the connection it needs and removes the unwanted ones. Now, that's what we are going to dive deeper into today. We are going to understand more about synaptic pruning and how this plays an important role when it comes to conditions like autism, ADHD, where we can intervene so that we can have the brain develop better and respond better to various tools that we're offering the body. So instead of simply asking, how do we manage the symptoms of autism? Um, we'll be asking a different question. What are the biological factors that may be preventing, this child from learning and developing and realizing the full potential? And that's what we all will be exploring today. We have with us, so I am Dr. Ruhi Agarwala, and we have with us Dr. Ashwani Garg, and he will take us to today's workshop. We will have time in the end for live Q&A. You can also ask your questions in the chat. Please mute yourself during the session. And with that, I hand over to Dr. Ashwani. Over to you.
Thank you so much, Dr. Ruhi, and good evening, everyone. Thank you so much for sparing out your time this evening. Well, autism is a complex topic, subject, and a complex problem, of course. It's not easy, to fix or to do something, but we all trying to understand it better so that we can create better possibilities for our kids, right? So today, autism is largely looked from the angle that this is a behavioral problem, and somehow we can do some therapy, things like that, and maybe we are able to recover. But actually, there's a lot more in the biology which is not all right, and because of that, there are behaviors, there are lack of abilities, lack of understanding. All of that is there because there's poor biology, and one of them is the poor brain health. Okay. And this is what we will try to explore today: synaptic pruning and its connection to brain optimization and ability of the brain to do better, or if not happening the right way, probably it can lead to a lot of sensory issues, a lot of um, poor quality sort of brain health, leading to all the sort of issues that we see in ASD, in ADHD, in GGD. Okay. Now, all of these diagnoses are based on the symptoms the child is sort of showing. There's no objective assessment to look at the brain. Okay, based on the symptom the child is throwing, we put them into different brackets. But still, we fail to see why it is happening. What is the reason behind it? Okay. Now, basically, in simple terms, as the body and the brain is developing, a lot of connections are being built. Now, that we simply call it a synaptic connections. Synapses are being created in the brain. Okay. Now, during early development, there could be surplus of the synaptic connections. There could be extra connections body will have, the brain will have. Okay. And this gives a rich raw material to the working, developing brain. There could be extra connections built by the brain for its own good. Okay. And there is a process by which the microglial cells will identify the unwanted synapses or non-performing cells or redundant synapses, and it will remove it. Okay. Now, why this matters? Because it will thereby help the development of language, sustain attention, efficient learning, and sensory regulation. Now, for example, now there is extra pruning happening. Sorry, extra synapses are there. For some reason, this process of microglia, which has to prune these extra connections, extra wiring in the brain, has gone haywire. Either it is under prune, undercutting of the unwanted connections, or over burning of these connections. Both way, they could be a problem with the child. So body brain will do it deliberately, these extra connections, so that there is enough for the body to brain to develop among. But process of pruning by the microglia will lead to cutting of this extra unwanted redundant connections. And if some reason this is halted, or this is changed, or this doesn't happen the right way, there can be less pruning, and there could also be more pruning, and thereby poor connections, and thereby language can be distorted, attention can become a problem, learning can become a problem, sensory regulation can become a problem. So lot of time, almost 80% of the time that I speak to the parent would tell me that child was doing okay, things were okay, and at the age of 1 year, 1.5 years, sometimes 2 years, the child started having a regression, loss in ability. The child was doing okay, then there's a loss in ability. Most cases, there's a loss in ability that we call it a regression. Now, this happens after a vaccine. This happens after, uh, let's say, antibiotic, after a viral fever, or too much of screen time, or a combination of things. So, looks like something has done a damage to the immune system, and microglia part of the immune system gets dysregulated. Thereby, this pruning mechanism is dysregulated. So, regression possibly is a process of poor pruning, either more or less. Thereby, regression and loss of the abilities. Hope that gives you some level of, at a very, very baseline understanding. Okay. Now, today, the data is there. This, of course, when it comes to large practice, we will still has to see. Now, but imaging technologies are showing that, or postmortem analysis are showing that autistic brains has more synapses than a neurotypical brain. So maybe in some cases, less pruning happens than the required. So extra connections, redundant, unwanted connections could be there. And this can lead to sensory overload or processing differences. Thereby, attention can problem, processing of the sensory inputs can become problem. Thereby, we have a diagnosis. Diagnosis does not give the problem. Underlying issues gives the problem, symptoms comes, and we put the symptoms under a diagnosis. Now, interesting, like I said, what is affecting this pruning? Either more or less, what it is caused by. One of the thing, immune get dysregulated. And immune system can get dysregulated. One of the known thing the vaccine can cause is an immune dysregulation. We are forcefully shocking the immune system by vaccine. Vaccine has its own sort of a antigen, and it has adjuvants like aluminium, things like that. Now, one of the purpose is to shock the immune system. And sometimes things don't right, and immune system goes haywire, immune dysregulation can happen. Thereby, the microglia does not do the right pruning, either under pruning, over pruning, and problem can happen. Or many a time post antibiotic gut becomes a mess. There's more overgrowth of the unwanted pathogenic microbes, could leading to dysbiosis, leading to poor gut brain signaling, leading to poor pruning in some cases. Now, any process in the body, any function in the body needs enough energy. If the mitochondria function is poor, less energy, again affecting the pruning, again putting the child onto the risk. And of course, there could be some genetic factors along with it. Well, we cannot change the genetic, but whatever in our hand today, let us try to understand that better and try to put some actionables so that we can help our children. Okay. So chronic low grade inflammation can dysregulate microglia activity, shifting them from maintenance into prolonged activation state that impairs the healthy pruning. Now, some trigger of inflammation in the body is there, and one of the reason is, let's say, heavy metal. One of the reason is infections. The microglia can go on a overdrive also, and healthy pruning is off under over pruning, damage to the brain. Mitochondrial function is important for energy production. That is required for all the processes. One of the synaptic remodeling. Whatever body and us in the brain are learning, that is remolding our, rewiring our brain, but that needs energy. If energy production is compromised by the mitochondria, then also this remolding becomes a problem. And a lot of time we see this hyperactivity, this higher excitation of the brain because there is more excitatory things going on. For example, glutamate is high, histamine is high, tryptamine is high, and the braking system, which is GABA, which is things which is sort of balancing this excitation to inhibition, is poor. Now, imbalance in the excitated to inhibitory neurotransmitter signaling can destabilize pruning environment and again can contribute to sensory and attentional dysregulation. Okay, gut brain, enteric nervous system, and the gut microbiome exert significant influence on the brain development by immune, metabolic, and vagal pathways. So, gut is poor, it can affect the developing brain. Sleep quality. Today itself, I spoke to mother. Mother said the child is just 9 months old today, and one of the definite thing that is happening, a child is not sleeping, and eye contact is poor today, and there is a hand flapping in the child. And sleep is so important. We don't get this child enough sunlight. We expose them to almost all the time into screens, and we give them a lot of artificial lights that affects the sleep quality. When that happens, lymphatic system clears, which clears the metabolic waste, becomes a problem, thereby again affecting the pruning. Of course, deficiency of nutrients, zinc, omega-3, vitamin D, B vitamins, magnesium, that also can affect the synaptic formation and pruning efficiency. So hope you get a little more, inside information. If child has gone into regression, child's brain is not developing properly, there could be so many reasons, and one of the reason could be poor pruning, under over pruning, and the reasons behind that could be inflammation, could be poor mitochondria, could be more excitation, can be poor digestive health, can be poor quality sleep, and nutrition. So at least these are things we can work upon. We can do something about it, right? And create a better possibilities for our child to become more healthy. Now, this is important for all of us to understand. Now, ability of the brain to rewire, neuroplasticity. Now, it is always there. That ability to rewire is always there. But there are critical windows where the ability is far more greater. Ability to change is far more greater. For example, till the age of 3 years, it's the highest peak synaptic density and highest degree of plasticity. Okay. Then the period of 3 to 7 years, there also intensive pruning continues. Language, executive function, social cognition circuits are refined. Early intervention during this window yields most robust outcomes. So when we're working with a child, the younger the child is, the better that we may expect the outcomes, right? So as the age grows, possibilities are always there, but possibility become narrow, right? As early as 3 years, possibility is higher. From 3 to 7, it's still great. After 7, it start decreasing. So let's say, in simple terms, today, if brain has a problem, if child comes to us at the age of 1.5 till 3, there is higher chance the child may become absolutely normal. Then compared to somebody when comes to us after 7 years of age. When a child comes to us after 70 years of age, there is more difficult to achieve that close to normal. There will be still improvements happening in the child. And that also depends on how much the problem is already there. If let's say a lot of repair has to happen, then the outcome may also vary. But this is important that as parents, early we intervene, aggressively we intervene, we put all the best efforts early on, the chances much higher. So these are windows of neuroplasticity. And early on, the windows are much greater. So earlier intervention offers greater biological opportunity. But it still happens. Something will still change. Early on, the impact will be much greater. So just again, a little bit on the microglia. Microglia are brain's resident immune cells. And in healthy conditions, they function as expert gardeners, continuously surveying neural tissue and selectively pruning synaptic connections to refine the circuit architect. So this is microglia is a very important cells of the brain, which is constantly cleaning up the system. Let's put it that way. And one of the things that we see in autism is a overactivation of the microglia. When it is chronically active, often with persistent infections or poor gut health or some heavy metals or poor mitochondria, then it shifts to a reactive state. And always it's sort of kind of doing a damage to us. So if we do the right things, we clean the gut, we clean the diet, we clean the microbiome, we clean the toxins, we may calm down the microglia so that it is not on a chronic activated drive. This dysregulation of the microglia is increasingly implicated in learning sensory behavior profiles in ASD, ADHD, and GTD. So now science is becoming abundantly clear, but there's still people saying nothing can happen, nothing can be done. There are doctors making videos, they're calling themselves experts, but they don't connect themselves to latest information, and they're still saying that nothing can happen. Let us accept the way the child is, whatever deficits are there in the child, let us accept that it and live with it, which is even more worse. If we can do something early on, we can make a change. Even not, let's say we cannot 100% fix it, we fix it to 80%, we fix it to 60%, it's still a great deal, right? A child should become capable enough to live their own life. When a highly trained doctor says nothing can happen, just because they have not been upgrading themselves, and this is because of that most of us can lose the opportunity to do something about it. Now what is that again we have to do? Preparing the brain for learning, right? First we have to improve the brain, then we can make sure that it can learn that we are trying to teach them. So we reduce the inflammation, whatever the triggers of inflammation in the body affecting the brain, we can reduce that. We can improve the digestive system. We can support the mitochondria with enough nutrients. Whatever missing, based on the testing, we can always test and see what the things are missing in the body. Improve the sleep, lot of sunlight, lot of darkness. If it comes to that, we can use red light to induce sleep. Okay, if required, we can use melatonin also. Sometimes CBD oil also comes in handy. Whatever it takes to stabilize the sleep and nourish the body. This is the first line. And as the brain is growing with the age or healing with the age, sometimes doing this much things is good enough. And early on, child may come out of the problem. But sometimes we have to take extra work. We have to put extra effort to increase the neuroplasticity. Okay, we have done the basic functional foundation. We have done the functional medicine testing and all that, and nutrition, all of that. And beyond that, we may have to look at peptide therapy. We have to look at regenerative medicine, such as mesenchymal stem cells. We have to look at exosomes, things like that. And they can also improve the plasticity. So first, calm the microglia. What is causing the damage has to first be calmed down, right? Improve the mitochondria. Control the excitation. Can be histamine, can be glutamate, can be tryptamine. And finally, we want to increase the brain-derived neurotrophic growth factors, BDNF. We have to improve that so that we can open the window of neuroplasticity. Now, calming, there are some nutrients, luteolin, PEA, omega-3, curcumin. Sometimes if inflammation is very, very high, maybe low dose of steroids, certain peptides like CLAC, CMAX, some antihistamines that we use. If histamine-driven excitation is there, which is causing the microglia activation, we may use some antihistamines like cetirizine, Actarax, things like that, or some thymus peptides. And we have seen exosome nebulization also helps a lot of these kids to calm down. Okay, because overactivation is sort of reduced and microglia becomes a little more calmer. Then we power the mitochondria, like we mentioned, B vitamins, N-acetylcysteine, glutathione, whatever is missing. It's not that we have to put in everything. Whatever is low as per the test. PPQ, urolithin, carnitine, CoQ10, things like that. And certain probiotics, which may reduce the toxic burden onto the brain. Then we want to reduce the excitation. Magnesium threonate can be useful, theanine can be useful, taurine can be useful. Okay, postbiotic, butyric acid can be useful, things like that. Okay, then we want to increase the BDNF where peptides. After the peptides, cerebrolysin is a good one, CMAX is a good one, mesenchymal therapy is a very, very good one. Okay, so among peptides, Cmax can increase BDNF, can improve memory. CLANC can reduce anxiety, can improve learning. Cerebrolysin is a very potent peptide, can improve brain-derived neurotrophic growth factors. It can also do synaptic repair. BPC 157 again can fix the gut-brain immune regulation. So once the basics are done, we can look at this advanced. Now, somebody can say there's no data, there's no research, there's no clinical trials. Well, somebody has to put money to run these. Now, at individual level, all these molecules, there's some level of data is there, not in specific to autism, right? Now, typically, clinical trials are run by big pharmaceuticals. People have money and they want to make more money. They come with a molecule, they run a trial, produce data, and it is given to the doctors. But autism being a very, very complicated problem, nobody want to do that. Now it is left to us as clinicians, few of us or parents, to try figuring what is the best that we can do for our child in a safer way. Now, unfortunately, India, there's a ban and all that. Now, this is true that stem cells cannot fix the autism. It's a multifactorial problem. Gut is involved, immune system is involved, toxins are involved. So much is happening in the child. Now, but stem cells has some play that it can help us with. It can calm the microglia. It can improve the mitochondria. It can modulate the immune system. It can improve the neurotrophic growth factors. And thereby, it can open the neuroplasticity window also. Okay. Now, it is not the 100% solution to the problem, right? That we do it and everything is sorted, but it can add value. Okay. Now, we do the basics and we use these advanced therapies to help us, not completely recover it, to help us to whatever extent that we can go with it. Okay. So once we do these things, let's say your child is under therapies and previously they were not responding to it. Eventually, if we do these things, eventually you will see that child start responding to these things. Once we open up the window, we do some level of repair. Learning can happen only if there's a repair happening into brain also. Without repair, how will the brain learn? Okay. So we have so many examples. One example is, let's say, like I said, early on, when a child is at a 3-year age, 4-year age, possibilities are much higher. And there, even the basics, you work on the diet, lifestyle, infections, toxins, nutrition, a lot of improvements can come. With the age, you have to put extra effort and keep putting that effort. So just with the basics, we see improvement in engagement, we see better sensory regulation, we see better participation into therapies, and of course, the progressive gains in the language also, right? So, so much can happen. It's not a dead end. Once a diagnosis is there, that nothing much can happen. This is not true. Lot much can happen. All right. So it is important as families, as parents, it's a difficult problem, but just a diagnosis does not mean that there's no way we can go and do anything about it. There's so much can happen, right? So we don't have to blame ourselves for it. We don't have to blame our genetics for it. We just has to keep looking for better answers which are not there by the conventional means. Okay, typically conventional means there's a problem, they say first wait. Let's say your child is 9 months and 1 year, you see some problems. If we early on intervene, even a quick fixes can really bring them out of it. But a lot of time what happens, you see a problem, you go to doctor say wait for 1.5 year, 2 years, then we'll give a diagnosis. Now, typically what happens, there is a diagnosis and therapy, diagnosis and therapy. Nobody's trying to tell you what is going wrong, why is the child behaving in a certain, for example, one child is doing a hand flapping. One of the reason is gut driven histamine release leading to more excitation, leading to more hand flapping. We need to figure out what is the play, why the child is doing in certain ways, and eventually using the tools that are at least available to all of us to improve the brain health, improve the microglia, improve the neuroplasticity, and thereby, when possibly, create better opportunity for children. Now, with that, let's open to more questions.
Thank you, Dr. Garg, for this. So we have a question in the chat. Does this mean the kids above 7 years cannot develop?
Well, again, please understand that I'm not saying that they will not develop. Now, depends on how much is the problem, right? There will be improvement, but early on at a younger age, improvement which will be much higher at a higher speed. With age, that possibility of neuroplasticity is reducing. This is the nature of the body, right? We may have to put extra effort. We may not still reach 100%. We may go close to normal, but may not become normal like that. So this is something, as families we have to understand that aspect. I'm not saying that improvement not will happen. Improve will still happen, but the how much it will happen will depend, right, on the age also, and how much is the problem with the child. If somebody comes 7 years with a mild problem, higher possibility. Somebody comes at a severe problem at the age of 3, then also it is difficult. Severe problem at 3 is still difficult, right? But depends on the problem, different the age, outcome may vary. That is something we have to understand.
So basically, there's a lot of possibility, a lot of potential if we start looking beyond what is very obvious in terms of symptoms. By looking deeper into the biology and what's really going on, there are a lot of possibilities of helping the child recover. So with that, if parents have questions, you can raise your hand and we can allow you to unmute and ask your question. I will also, in the meantime, launch a poll which parents can answer, and accordingly, our team can also connect then. Okay. Any questions, anyone?
Sir and ma'am, I have one question. What is the cause for?
1 second. Just let me. What's your name? Dividya, is it?
Baby? Yeah.
Yes, go ahead.
Yeah. What's the cause for the visual streaming, sir?
See, stimming is a kind of a repetitive thing, and one of the reason is higher excitation of the brain. And excitation can happen because of multiple reasons. One of the reason is higher glutamate, higher histamine, higher tryptamine, sometimes higher serotonin also. Okay, so anything which is causing higher excitation to the brain can cause stimming.
हेलो सर।
यस मैडम।
सर सर अगर बच्चा वायोलेंट बिहेवियर शो करता है, 5 years ओल्ड बच्चा, तो
Yeah.
इसलिए हमने पहले इसको मेडिसिन दिया हुआ है, वो भी डॉक्टर से प्रिस्क्राइब किया हुआ। तो फिर थोड़ा बहुत, पूरा नहीं, थोड़ा बहुत ठीक रहता है। तो फिर हमने सुना बहुत ज्यादा साइड इफेक्ट आ जाते हैं इसमें, तो हमने स्लोली स्लोली इसको बंद करने की कोशिश किया।
Yeah.
बंद करने के 1 महीने तक ठीक ठाक चला, फिर तो अभी बहुत वायलेंट बिहेवियर शो कर रहा है। तो क्या मेडिसिन ही सिर्फ एक रास्ता है, और क्या ये लाइफ लॉन्ग है, और इसके क्या बहुत ज्यादा साइड इफेक्ट्स होते हैं?
देखिए ऐसा समझिए सिंपली, अगर हम किसी को इचिंग हो रहा है, हमने इचिंग का दवाई लिया एंटीहिस्टामिन, है ना।
जी
जब हमने दवाई लिया तो इचिंग कम हो गया, हम दवाई बंद किया तो इचिंग फिर से आ गया।
जी
अब इचिंग आया क्यों था, उसका तो हमने सोल्यूशन किया नहीं, हमने एक एंटीहिस्टामिन डाल के टेम्पररी उसको फिक्स कर लिया।
ओके।
ना, एंटीहिस्टामिन या कोई भी ड्रग का शॉर्ट टर्म में यूज तो ठीक है, लेकिन लॉन्ग टर्म में अगर उसको यूज करते रहेंगे, एक तो इनफेक्टिव हो जाएगा, वो काम करने बंद कर देगा, दूसरा
ओके
उसका साइड इफेक्ट आएगा, और तीसरा जो प्रॉब्लम है, जिस वजह से प्रॉब्लम है, वो बढ़ता
जी
जाएगा,
ओके ओके।
है ना। और जब तक उसको फिक्स नहीं करेंगे तो प्रॉब्लम सॉर्ट नहीं होगा।
लेकिन सर उसको फिक्स कैसे करें? वो वायलेंट इतना हो जाता है कि वो तो थेरेपी ले ही नहीं पाता,
नहीं नहीं, आप शायद
क्लास ही नहीं
सुनने,
ले पाता।
नहीं नहीं, थेरेपी इज लाइक अ ट्रेनिंग। अगर मेरे अंदर की प्रॉब्लम है मैडम, किसी
जी
वजह से मैं अग्रेसिव हूं, मेरे अंदर में
जी
तकलीफ है,
जी।
बाहर में आप कितना मेरे को समझाते जाओ, मैं कैसे मानूंगा।
सर हमें पता कैसे चलेगा कि अंदर क्या प्रॉब्लम है और इसका क्या सोल्यूशन है?
करेक्ट। मोस्ट टाइम इन बच्चों का डाइजेशन बहुत भी कमजोर रहता है, ठीक है,
ओके
गैस होता है, ब्लोटिंग होता है, कॉन्स्टिपेशन होता है, वहां से बहुत सारा इन्फेक्शन टॉक्सिन शरीर में जाता है जो एक्साइटेशन करता है।
ओके। जी
ओके। इन बच्चों में हम देखते हैं लेड बहुत ज्यादा है, एल्यूमिनियम बहुत ज्यादा है, जिसकी वजह से प्रॉब्लम बना रहता है।
जी
ओके। तो हम जो करते हैं उसमें थोड़ा टेस्टिंग करते हैं, बच्चे का समझते हैं कि अंडरलाइन क्या चल रहा है ना, अकॉर्डिंगली वी
जी।
वांट टू डू राइट थिंग्स फॉर देम।
ओके
बहुत चीज मतलब लाइफस्टाइल, डाइट, इन्फेक्शन, टॉक्सिन, न्यूट्रिशन, माइक, इम्यून रेगुलेशन, फिर इवेंचुअली ब्रेन का प्लास्टिसिटी को इम्प्रूव करके उसकी एबिलिटी टू इम्प्रूव इट्स सिनेप्सिस, वो सब करना पड़ता है धीरे धीरे करके।
सर तो क्या वायलेंस नेचर चला जाता है?
देखिए मोस्ट केसेस में पॉसिबल है कि वो स्टेबल हो जाएंगे, एग्रेशन चला जाएगा।
सर कितना देर लगता है? अगर ये हम पूरा प्रोटोकॉल फॉलो करेंगे तो फिर शायद कितने दिन तक इसका
नहीं,
एग्रेशन वायलेंट कम हो सकता है?
बहुत सारे बच्चे तो 3-6 महीने में काफी अच्छा कामिंग आ जाता है, कुछ बच्चों में ज्यादा टाइम लग जाता है।
ओके ओके। तो क्या सर हम वो दवाई फिर से चालू करें या ना करें? हम तो
नहीं देखो,
बहुत।
ऐसा है कि जो दवाई है वो क्या करती है, कुछ रिसेप्टर्स को ब्लॉक करती है, फाइव
जी
एच टी
जी
टू ए रिसेप्टर को ब्लॉक करती है, जिससे ब्रेन का एक्साइटेशन टेम्पररी कम होता है, तो बच्चा थोड़ा काम डाउन हो जाता है। तो
जी
अगर कुछ और नहीं करे तो यही कर लो। हाँ, दवाई का साइड इफेक्ट क्या है भाई, वो वेट गेन होने लगेगा बच्चे का, है ना।
जी।
तो ठीक है, अब उसके अपने डाउन साइड है, लेकिन एटलीस्ट ऐसा फैमिली थोड़ी शांति तो है ना।
एक्चुअली वो
लेकिन
वायलेंट इतना हो जाता है कि हमें डर लगता है कि उसको भी कुछ ना हो जाए, और मेरी और एक बेटी है कि उसको भी कुछ ना हो जाए,
करेक्ट करेक्ट,
इसीलिए परेशान है सर।
तो टेम्पररी आप उस दवाई को यूज करो, एंड मीन
जी
वाइल जो अंदर की प्रॉब्लम है जिसकी वजह से हो रहा है उसके ऊपर काम करने की कोशिश करनी है।
ओके ओके सर। थैंक यू सर, थैंक
Sir, I have a doubt. So does screen time also lead to changes in microglia and cause a problem with synaptic pruning?
Well, lot of the kids are regressing after screen time. Okay, either it is impacting the mitochondria, thereby synaptic pruning is affected, one possibility. One is, the child may go into a lot of visuals, the language becomes poor. Now, any screen is typically connected to a Wi-Fi or any network, which is also itself is a radiation that can affect the mitochondria. But there are ways with which it can negatively impact, yes. But I cannot say for certain that looking at screen will cause that. But directly, indirectly, it is definitely causing it.
Okay, because many people say it only causes virtual autism, and once you take them off screen.
Okay, now see, this is another misunderstanding, that if something temporarily happens and all the time it can recover. A lot of time it doesn't recover and takes a lot of effort to recover. Just removing the screen and everything becomes hunky dory. It's a very, very naive thought.
Okay, 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 sir. Okay, sir. Yeah, thank you.
We'll take a question from the chat. Let's say if we do the functional medicine treatment and then if we do stem cell therapy, should we do stem cells after functional medicine?
Well, now this is important. Okay, now stem cells is like a signaling thing. It will improve the brain derived neurotransmitter growth factors, thereby better connections, synapses, neurons, all of that can happen, better mitochondria. But before we do that, we have to optimize the body. Let's say signal is there, but nutrition is not there. Signal will not turn into brain. As simple as that. Or if infection toxins are in their high amount, which is causing neuroinflammation, causing damage, we put in stem cells, some level of repair will happen. Again, damage can happen. For sustainability of the outcome, let's say we want to do this, these are expensive, aggressive processes, very, very powerful, but it's a lot of money required for that. So before we do that, we have to prep the body, which means we have to reduce the toxins, infection, arrest the body. At least we achieve that so that we keep doing our regenerative medicine and it keep giving us sustainable results. This is important.
Right. And how much time would it usually take to see great improvement with mild autism with functional medicine?
Well, see, again, this is not a standard answer. If a child is, let's say, 2.5 to 3 years old with a mild autism, okay, I can say 9 months to 12 months, if we do it right way, we follow it the right way, turnaround can be there and the child most likely can come out of the diagnosis. Now, I'm saying 2.5 to 3 years old with a mild autism. Now, more the problem, higher the age, more difficult and more effort. And like I said, possibility relatively will reduce.
Okay, any more questions? Okay, here we have Ramesh. Ramesh, can you unmute and ask your question, please?
Hi, Ashwini sir. Hello.
Yeah, Ramesh, please go on.
Hi, sir. As you know, we are like Vishan parents only. And we are in seventh continuity plan for the FMC. Um, we are we are we're in the first month of seventh continuity plan.
Okay.
We are observing that child is like roaming continuously, directionless, and he is on his own world. Visual stimming also, like he is like with his hands, he is making the moves with his hands, fingers, with his hand fingers, he is making the moves. He is like, we need to call multiple times with his name, Vishan, 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 like that. With loud, then only he is responding. I observed that other thing.
Ramesh, is recently started happening, it just, or it has been persistently being there, or it never could improve?
This behavior of roaming here and there. So I can say we are not seeing this behavior before FMC side. We are seeing this behavior more after FMC medicine, and it is not reducing.
And I'm saying now it's seventh continuity. It has been there since FMC is happening, or it is recently started?
This directionless moving from here and there, it is there, sir. It is there.
It is there. All right. Fair.
is
Let
there.
me look at the treatment plan, Ramesh. Then I can come back to you. See, again, let us understand that what are we trying to do? I mean, if it's okay that we can correlate that since FMC is there, since we are intervening, and because of since that time it is starting. Now, as the age will grow, disease will underlying problems can grow, and the problem may be there. So let me have a look at it on the test and what we have done, and then we can see what can be done.
We need to call multiple times with his name actually.
I get it.
Vishan, like that.
Hmm.
He's not responding actually, even calling multiple times his name.
Okay. I'll take a note of it, Ramesh. Okay. What is his name, Ramesh? Child's name?
Dvishan, DVI.
DVI.
Yes, H
SH.
AN.
Okay.
Vishan. Srinivas Dushan.
Not responding.
Name is Srinivas Dushan.
Okay. Anyways, I have your name also, Ramesh Babu. Okay.
As I mentioned, it is 7th continuity plan, sir.
Fair. But fine, I cannot. I noted it. Okay. Okay. All right, Ramesh. I'll get back to you on this. Next, Glodwin. Yeah.
Good evening, this is Gladwin.
Good evening, sir.
My daughter is 5.5 years old and she is mild autistic. She is able to speak now, but yes, there is a lack of concentration and lack of focus. So we just opted to join, and in between this session was there, so we are attending this.
Sure.
Yeah. So my query was whether any visit will be required at your end, or
no,
will
not
it
required.
Yeah.
It's all online. We'll test the child wherever the child is.
Okay. So this testing period, how much time it will take?
Well, usually a blood test within 2-3 days. Once a sample is given, report will come, and there's one organic acid test which may 5 to 7 days once a test reaches the lab.
Okay. And post that, some medicines will be provided by you?
Well, it depends on
based on the reports.
So like I said, infections, toxins, nutrition is the goal to optimize. For that, we may need a supplement, we need a probiotic, we may need antimicrobials, we may need something to support the liver, things like that.
All this, what you are telling, will be allopathy only?
Well, allopathy by definition is largely pharmaceuticals, and pharmaceuticals largely we have drugs where nutraceuticals has less role to play. What we will largely deal with is nutraceutical.
Okay, then looking forward for a positive result. Yeah.
Sure, Gladwin. Khushbu, if you're there, you can unmute. Khushbu, you can unmute. All right. Well, is there any questions? Let me see. Amrish, your question is how to cure self-biting. Well, not a simple thing, but yes, a lot of the times we have seen parasitic infection is one big play in self-biting. And considering age, it may take some time. It's not easy, but it can happen, but it can take some time. Kanak, you ask, what is your opinion of FMT? Yes, fecal transplant is a good deal as long as basics. Again, I'm saying stem cells, fecal transplant, exosomes, these are all aggressive processes and they're useful. They have a lot of value to add, but we have to prep the body even before we do that. Something we have to understand is your microbiome is controlling your immune system. Immune system is controlling your microbiome. Now, if heavy metals are sitting in the blood, which is compromising the immune system, I change my microbiota. If immune system is not keeping well, it can get bad again, right? So basics before even we do anything aggressive. We have to make sure diet is good, lifestyle is good, toxins are reduced, heavy metals are reduced, nutrition is uplifted. Then we can look at that depending on the problem. In some cases, you do antimicrobials, you antifungals, you do anticlostridia, microbiome gets stabilized. Then you don't need FMT. But in some cases, we do all the circus and and the microbiome doesn't get stable. That means infection doesn't go. Probably then that is a case where resistant infections are there. We can make use of the FMT. So case to case, it varies. All righty. Well, I think looks like we have addressed most of the questions. If you have done your poll, you can then we can close it. Anwar, we can close it or anything else?
Yes, sir, we can go ahead.
Thank you so much, everyone. I appreciate your time on the evening. Thank you so much. Bye-bye.
Thank you.